Welcome to this Zoom seminar, virtual seminar, very appropriate for our times. I'm Ashutosh Varshney, Director of the Center for Contemporary South Asia at the Watson Institute at Brown. And our topic today is the coronavirus and its implications for India's political economy. As you know, the novel coronavirus has shaken India, as it has shaken much of the world, or perhaps all of the world. Consequent upon the announcement of a nationwide lockdown for 3 weeks, huge migratory flows amid difficult conditions were reported from several cities, though Delhi got the maximum attention given how many people were leaving Delhi. So how does one understand the Indian crisis? What does it share with crises elsewhere? And what is quite unique about it? What are the short run and medium run implications for India's political economy? Long run implications are always very hard to predict, but we can be more confident about the short to medium run implications. To help us understand these implications, we have with us Roshan Kishore, data and political economy editor of the Hindustan Times, which, as many of you know, is a leading newspaper in India. And he is spending this semester as a visiting fellow at the Center for the Advanced Study of India, CASI, at the University of Pennsylvania. The format will be as follows. We will have Roshan and I. Roshan, can we focus on Roshan for a moment and see? Roshan, can you say something so that people know it's you?
Hi, Professor Varshney. It's a pleasure to be here.
It's a pleasure to host you, Roshan. And after our 30-minute conversation, which I will lead, we will open up for Q&A. And our community at Brown will ask you questions. So we expect this session to go on for about an hour. And if it so happens that we go over a little, we'll keep the link going. So when we think of the consequences of India's nationwide lockdown, the most important issue is its impact on the poor and the low income groups. I think most people understand that the rich and the upper middle classes, though some tragedies could happen there, and the middle classes would be affected less. And there could be life and death consequences, very serious consequences for the low income segments of Indian society. And here there are clearly two sides to be analyzed, two aspects to be analyzed: the farm economy and the non-farm economy. As you say in your article for CASI, even in the villages where roughly 65%, maybe 64%, maybe 66%, we'll know for sure next year when the census results come out. Even in the villages where roughly 64% of India still lives, reliance on farming for household incomes is going down. India, in any case, agriculture is only about 14% or so of India's GDP, but 65%, 2/3 of India roughly, plus minus 2 points, continues to live in the villages. According to your data, farming accounts for not more than 40% of rural incomes today. And rural migrants who come to the city earn most of their, or sometimes all of their incomes in the city, but most of them, and if not most of them, many of them, perhaps all of them, um, not sure, let's say most of them, perhaps all of them, still see the village as their home. They're secular migrants. They come to the city to make a living, and they keep going back to the home, which is the village. So there are at least three kinds of poor people that call our attention for this analysis. The rural poor who were or are migrants in the city, but keep going back. The rural poor entirely based in villages, who are not part of this secular migration between the city and the village, are landless laborers, small and marginal farmers would obviously be the three subcategories within the category of the rural poor, who are almost entirely based in the countryside. And the urban poor or low-income households in the city, most of whom, perhaps all of whom, but most of whom, for sure, have lived in slums for a long time, have lost connections to the countryside, and who are now urban. So these are the three categories of the poor that we need to pay attention to. The rural poor who are in the city, the rural poor who are in the countryside, and the urban poor who've been living in slums for a very long time, and for all practical purposes, or perhaps really in actual fact, have lost connections to the village. So how has lockdown affected each of these groups according to you? And are there any other poor groups that this threefold classification leaves out, which we should also consider?
Well, before we try and answer that question, I think let's take a step back. And so what does the lockdown actually entail in a country like India? So if you've been following Indian newspapers, Delhi's air quality, the AQI is now below 40, 50, after decades probably. From Jalandhar, you can actually see the Himalayas now. So this means that the entire economy is at standstill. There's absolutely no production, no vehicular movement taking place. So in a very cruel sense of the term, it is like everybody has gone on a holiday. Nobody is working. Now, you made a very useful classification of three kinds of poor. I think the urban poor, who are generally based in slums, etc., who do odd jobs in cities, we don't know. Some people, I would like to believe that part of at least domestic health, etc., their employers are at least paying them for a month. So maybe it's not bad for them, that bad. I'm sure things are bad. For people who are actually migrants, I think other people, for example, Tariq has also argued that it was actually perfectly rational of them to go back, because they live on a pretty much hand-to-mouth existence, and it is not just managing food, but they are also vulnerable to the police harassing them. They are also more vulnerable to landlords, because the slum dwellers are actually, they belong to the city, so they have some sort of a support system, whereas in case of migrants it's very difficult. So not only have they lost their incomes and livelihoods, but they actually are also at the greatest risk of being infected personally, because they have traveled in very harsh conditions where there's absolutely no social distancing, etc. So this is definitely the worst hit community. As far as villages are concerned, I think it's slightly tricky there. Now, one can expect in an Indian village today, I'm sure there would be exceptions, that the PDS, the public distribution system, with all its problems, I think that it is largely functional. So I do not see starvation at a very large scale.
In this,
of course, till now we have been told that the lockdown would be in place till 14th, but I do not think that anybody is under the illusion that it could not go beyond that also. So we would all be very happy if it were to be withdrawn then, but I think everybody is now mentally preparing themselves to the fact that it could actually be extended. So starvation would not be a problem, at least for a significant amount of people. But there too, the agricultural economy is actually taking a very big hit. Like I said, the non-agricultural economy has come to a complete standstill. So today, a colleague from Mint, which is HT's business paper, has done a story where he's actually said that once the wheat crop etc. is harvested and farmers have absolutely no clarity on whether the government will be procuring food grains etc. That has become a big problem. Now I work in Delhi, but my family is in a place in Bihar called Gaya. So I've been speaking to my parents and I've been speaking to my family in Delhi also. So in Delhi, actually vegetable prices etc. have increased because supply lines have taken a hit. Whereas in Gaya, which is small tier 3 town in Bihar, prices have crashed because not only are they not able to sell their produce to larger centers, every migrant worker who's actually come back, or we must remember that circular migrants don't only come to from a village in Bihar to Delhi. They also come from a village in Bihar to a place like Gaya or other district headquarters. So everybody who was an ice cream vendor or who was selling cigarettes or who was selling chaat on a wheel cart, everybody is now taken to selling vegetables because that is the only thing which is allowed now. So there also incomes have taken a huge hit. So by and large, it's a very tricky situation. Whatever.
Can I interrupt for you for just a second? Isn't another complication in the countryside that this is the harvesting time?
Yes.
And the winter harvest, the rabi crop, is to be harvested typically in April, and a lot of labor is at least in states like Punjab and Haryana and Western UP, a lot of the labor that is needed for harvesting comes from some other place.
It must have gone back. We don't know.
So if they have already gone back from the villages also, then there could be labor shortages in the countryside or not.
So like I said, you will actually see pockets where you have a shortage of goods and labor, and you will see pockets where you have an abundance of goods and labor. I mean, the latter would of course be the underdeveloped, poorer pockets, whereas the former would be richer pockets in the country. We now are getting reports of farmers feeding strawberries to their cows because they anyway can't sell their produce. So it's that bad. The other thing, Professor Varshney, I think it is extremely important. I think that and right that the poor are getting the worst hit. But you were speaking about the short term versus the long term difference, and let's not talk long term, but at least the medium term. I think in the medium term, the consequences would probably be much harsher for big businesses. I mean, when I say big, I don't mean a Reliance or something, but actually for the not so poor people, because the poor live a hand-to-mouth existence anyway. So one day they don't earn, they starve. So a hit to them would not have serious repercussions on investment in an economy. Whereas if businesses start getting hit, if banks start getting hit, I mean, all of which is happening, airlines are not working, hotels are not working, the entire economy, even the formal part of it has come to a complete standstill. So there also, I think this is a very large reason to worry, and so India has, it is in the unenviable position of having to deal with an informal sector, but I mean, almost all problems which will face the American economy will also face the Indian economy. Our stock market would be extremely volatile. So the shock it's a double whammy for countries like India.
Yeah. So investments, if they decline, they of course hurt the business community, but they also hurt those who would be employed, right? A number of people who don't have labor contracts and formal economy, formal labor force is still, you would know the most recent data is still about 10 or 12% of the total workforce. 85 to 88% of the workforce is in the informal sector, with most of them not having proper labor contracts, right? Yeah. Okay. So how about the urban poor? The urban poor, there is one special characteristic about the urban poor which we might wish to note. And that is that if they're in slums, and normally that's the case, or in shacks would be, according to our urban governance project, below slums, right? If they're in shacks or in slums, they're very densely living together.
Yeah.
The rural poor would not have, the countryside doesn't have, it's not described by political economy as a dense place.
That's right.
The city is the dense place. So if density is an important variable in the transmission of this virus, wouldn't the urban poor, via density, via the channel of density, be also very seriously affected?
See, I mean, neither of us are, medical experts. So, the exact technicalities, it is slightly difficult to comment on. But the way I see it, because, I mean, testing, given India's population size, is still very sketchy in India. I mean, we are testing, but it is clearly not enough. Even for a country like the US, the testing standards are not enough. So how can it be for India? So we don't even know whether we are in the community transition phase. That's one. We don't know. I absolutely agree with you that, living conditions, and when I say living, actually the dwelling conditions in Indian slums are actually much worse than what they are in villages. And not only is density very high, but actually, access to something as basic as a toilet, water facilities, etc. Those things are also quite bad in Indian cities. If this happened 10 years ago, I would not be so worried. But, for example, in a city like Delhi, actually, once you've had the metro, it is actually a very class agnostic mode of transport now. It is costly for the poor, but now the rich and the poor travel together. Otherwise, unlike say, big city in the United States, Delhi, India had a very class ghettoized, mode of transport in cities also. That unfortunately, as the country develops more and more, will not be the case. So clearly, the urban poor are at higher risk, and a lot of them actually work with very rich households, because in India, every well-to-do household employs at least 2-3 people. There would be one domestic help, probably a driver. So, the poorest of the city interact with the richest of the city at a daily basis. So, definitely there are chances of there being transmission.
Yeah.
And anyway, our track record in recognizing the dignity of the work urban poor deliver for us has not been very good. And we have been hearing stuff that gated communities are not allowing people to enter, they're not being allowed to work, etc. So this is only going to bring up that question of dignity in an even bigger way. I think the resentment which the urban poor will have, because let us remember, they did not bring this disease into the country. So it is completely an imported phenomenon as far as India is concerned.
Some of the work done by Chinmay Tumbe, who is, as you know,
at IIM Ahmedabad.
At IIM Ahmedabad, and has produced a book on migration that all of us have read, and a lot of people have read. When asked why Delhi observes such huge migratory outflows, thousands and thousands of people walking miles and miles and miles to reach their homes, and some homes were 300 kilometers away, some homes were 500 kilometers away. And presumably you can't walk more than 50, 60 kilometers a day. How much can a human being walk in a day without collapsing, right? So walking for 10 days, 8 days, 9 days, this huge migratory outflow from Delhi, why do you think that happened? He says Delhi, do you agree that with his view that Delhi has perhaps the largest, even compared to Bombay, Delhi has the largest concentration of migrant workers from the countryside? Bombay may have more migrant workers, but not that many from the countryside. They would be from the smaller cities of Maharashtra and Gujarat, and of course some from UP.
I completely agree. I mean, I don't have the census numbers offhand with me, but a couple of months ago, the Delhi elections happened.
Yeah.
I think the biggest vote bank up for grabs was the Purvanchali vote bank there. I mean, the BJP state president is somebody who is actually a Purvanchali.
That's Eastern UP, right? So
Eastern UP and Bihar. I mean, when we say Purvanchal, they actually include both. So I think Purvanchalis could be anywhere between 30% of the Delhi city's population. And not all of them are circular migrants laborers, but there are areas in Delhi which are huge and which are completely comprised of migrants. And places which were closer to Purvanchal, such as Calcutta, etc., those cities stopped growing very long ago. So there's a section which goes to Mumbai and other cities in Maharashtra, but there's a very large section which actually comes to Delhi.
But is it? We didn't get any reports of mammoth migratory outflows from Mumbai, from Chennai, from Bangalore. There were some reports. of small outflows. But the kind of truly massive uh, outflow of migrants from Delhi, wasn't that quite unique?
Uh, I think that's the sheer size of migrants in Delhi, and because Delhi but I think also it's partly because Delhi being the national capital actually gets a lot of media attention.
I see.
That is always the case with Delhi. It is not just vis-a-vis this.
So it's an artifact of what Delhi
Partly,
politically
yes,
is. What Delhi politically is. It's possible that there were also lots and lots of flows from elsewhere. I saw one.
I would like to ask you something. Now, you have worked for a very long time on ethnic violence, communal rights in India.
Right.
Until a week ago, one was hearing odd reports of actually people from northeastern states in India,
right,
being attacked publicly, abused publicly. They were also facing violence, being called Chinese and virus, etc. And now, of course, with the incident in the Tablighi Jamaat mosque in Nizamuddin, it's taken a completely different color. Now, one thing is that, and whatever one is hearing, part of it is definitely, people acting in a bigoted way, but part of it is also genuine fear. People are scared. Nobody knows, because everybody knows that there's no cure as of now for this disease. There's no vaccine in sight, and it's spreading very fast. I mean, it's there to see in the world. Now, India, because inside the country, there are absolutely no curbs on migration, legally speaking, and people have been free to go wherever they want. There have been tensions, but do you see this fundamentally changing from now on? Even when we have a vaccine or something, which is something I've argued in my article also, that the memory of this is going to be entrenched for a very long time. Do you see this affecting our society fundamentally in a way?
I think there was always some prejudice, if that's the right word. Is that's the word I want to use? Yes, I think so. There was always some prejudice in northern India and southern India against the northeastern communities, right? That's a lamentable fact of North Indian urban life, and South Indian too. I saw it in Bangalore some years ago, where the northeastern community had to leave by the hundreds of thousands, actually, because there's such a huge migration.
Yeah, when boy was killed.
Yeah, that's right. So I think there was always some prejudice against them, and one of North India's, at least urban North India's, struggles or challenges. Challenge is the right word. Challenges is to give respect, sufficient respect, and equality of treatment to the northeastern migrants to the city, and or those who look like they have northeastern features, etc. So I think that prejudice, the eruption of that prejudice, though it was not on the same scale as in Bangalore some years ago, was not surprising, however regrettable that was. Not surprising empirically speaking, normatively highly objectionable, right? But I think what happened in the Tablighi Jamaat incident, and its use by a lot of right-wing Hindu nationalist forces, essentially returned the political equilibrium to its older form. As the gathering in Tablighi Jamaat led to, I think by now it's 500 who tested positive, who went to that gathering of about 2,000 odd people. So of 2,000 odd people in that gathering, 1/4 have tested positive. And then you have to do contact tracing. So it's possible that 500 have led to 5,000 or more. Now, that was definitely an irresponsible act, a terribly irresponsible act. But that had nothing to do with Islam per se. Nothing to do with Muslims at large. That had something to do with Tablighi Jamaat, that particular a section of the Muslim community that is attached to the Tablighi Jamaat or listens to what they say about how to pray and how to practice the religion, or those who were there to learn from what the leaders of the group have to say, right?
This nuance, unfortunately, is lost
Yeah.
in the overwhelming majority in the country.
Right. Also, next to, I know this place very well. Next to that building is the great Sufi Dargah
Yeah,
of
Nizamuddin Dargah.
Magnolia, which is visited by Hindus, Muslims, Sikhs, Christians.
Yeah.
So that is the nature of Sufi Dargah, Sufi mausoleums. That's how they work. So there is while there are Muslim religious sites, there is always an interfaith character, inter-religious character to these dargahs. So people completely forgot that and attached Tablighi Jamaat to the larger Islamic, or to a larger Islamic connotation, and targeted Muslims, right? So I don't know whether this can change politics or the ethnic dimensions of, or communal dimensions of politics very seriously. You make a point in your article about how this might generate a political demand, or political parties might start thinking of organizing the urban and rural poor who've been hit very hard.
Yeah.
That has been a dream of left-wing politics since Nehru.
Yes.
Nehru wrote that. Nehru wrote in the 1930s, is there anything in common between the Muslim landless worker and Muslim landlord? He would say nothing. What is common, what the Muslim worker had, Muslim landless worker has a lot in common with the Hindu landless worker, right? But that didn't, ultimately, when the Pakistan movement emerged, you saw that the religious/communal dimension of politics trumped the class dimension of politics. So actually, now that we are at this point, maybe you can say something more about this argument you made in your article, that there is now a political moment for opposition political parties, or political parties in general, let's say, to organize the urban poor and rural poor around the huge suffering that they're experiencing and they're likely to experience, organize them in a politically interesting, a politically powerful way. Do you want to say something more about that?
See, I think the question is, a lot of people in India are criticizing the government, and there's no denying the fact that there's a lot of hardship going on there right now. But frankly speaking, I am no fan of the current government. But I don't think there's a lot the government could have done, anyway, because the kind of state capacity we have in India, right from public health to social security, etc. These things take time to build and deliver on. So within 20-25 days, a couple of months, not much can be done. My larger critique of the anti-BJP political spectrum in India, especially the Congress party and its leadership today, is that they actually, politics is not something which you do in the present. In a country as big as India, politics, successful politicians probably think 5 years, 10 years in advance. So, and which is something I've been witnessing here also in the United States, that your critique of the government, it is all right to pay lip service to what is happening today, but are you using today's crisis or the memories it leaves on people's mind to sort of rebuild your politics 5-10 years from now? Even before this, the opposition was anyway staring at a very big future in India, even though the economy had tanked before the 19 elections. I mean, BJP actually, Narendra Modi came back with a bigger majority, and it doesn't look like there was anything to sort of prevent him. He was losing state elections, but most of us have become convinced now that state and central elections people have been voting differently. Once this crisis is over, and let us hope that it is over, there would be competing demands on the state. So it is not only the poor who will make demands on the state, but the super rich and the rich will also make demands on the state. And a lot of them this time, let me say, would be rightful demands, because their businesses have also taken a hit. Today in the Indian Express, Arvind Subramanian and Devesh Kapoor have written a piece. So loans will have to be delayed, probably even waived off, taxes will have to be waived off, reforms will have to be done, because business, India today is not the India of 1950s. If the economy has to work, private sector has to play a huge role. So when those negotiations take place between the super rich and the state on the one hand, and the poor who do not have a negotiating authority unlike the super rich, what role does India's opposition play? I think this is a question which will be extremely interesting to watch out for as we head into the next month, probably the next quarter, all of the remaining year and so on, and probably even longer.
Okay, so let me ask one more question, and before we open it up, um, in what ways is the current lockdown similar to or different from the demonetization of November 2016, when 85 to 86% of the currency was basically outlawed, at least for a few months?
I think it's very different. Let me give a crude example.
Yeah.
So if we have the current lockdown in India where nothing's moving, there's no road transport, there's no business, there's no air traffic, there's no rail. If it were the case that the government had said that do whatever else you can, but you can't take the train.
Right.
That is what demonetization would have looked like. Where one important medium of the economy had been put on hold, but here we are talking about the entire economy on hold. So I think we're talking about fundamentally very different things here, which is why the pain will also be infinitely larger.
Right. And therefore, it's also not right to say that it's like turning India into a war economy, because even if it's a war economy, people move in a war economy.
Exactly.
Right. You can say and during demonetization, people were moving. Something was done to to currency, to notes, to currency, to the monetary system,
Exactly.
but people were moving about. Right. And now people are not moving. People are they staying home or have gone home and there's very little transport on the street. So this is different from even a war economy.
Yeah, it is different from a war economy in one more way.
Yeah.
Now, the greatest war which the planet has seen is the Second World War.
Right.
And, almost, no, not all of it, but large parts of physical infrastructure in Europe were gutted in the Second World War. So there was actually the question of reconstructing the entire infrastructure. When you will emerge out of this crisis, your entire infrastructure is going to be left intact. So there's no question of any immediate capital stimulus to the economy. There's not going to be a Marshall Plan right now, because you can't rebuild flyovers and houses and employ people. So it's going to be far more difficult to pull us out of this crisis rather than the war economy framework. It's
right.
Far more difficult.
So this is more serious than a war being waged against the nation, economically speaking. This is more serious than the demonetization crisis. This is orders of magnitude different, right? That's exactly what you're saying. It might lead to a serious recession for a year or year and a half, and that's of course that was not what demonetization did. Demonetization led to maybe some deceleration of the economy, but you can get into negative growth rate here.
Yeah. I mean, we're definitely going to be getting into negative growth rate, and there's absolutely no question about this. And it is not just us; the entire world is going to get into a negative growth rate.
Right. So it's not a question of coming. The projection, Moody's has predicted India will be down to 2.5% this year. It might go down further and might go into -1 or -2%, right?
Yeah.
Okay. Let me now start with a question that we've already received.
Mm-hmm.
William Lodge, he might be on the call, I'm not sure. William Lodge has...
Yeah, I'm on the call.
Oh, you're here. You want me to read out your question? Or you want to ask your question yourself?
You can just read it out.
Okay.
Yeah, sure. Yeah.
India has made, asks William Lodge, who's a public health, in the public health school, India has made significant improvements in reducing the rate of new HIV, tuberculosis, and malaria. However, there is still much work that is needed to be done. What are the unintentional consequences of COVID-19 response effort, that is nationwide lockdowns, on these public health efforts? In your opinion, does India have a health system in place to address COVID-19 as well as continue to meet the needs of people who continue to be burdened by HIV, tuberculosis, and malaria?
Well, William, I know very little about public health, but let me try and answer your question. It is completely true that India actually, even with its rickety public health infrastructure, has made very impressive gains. I mean, we eradicated something like the polio, for example. So that's there. We have a very, this government also, we almost have universal immunization in our country, etc. And things would have been very different if there were a vaccine for COVID-19. as it would have been in the rest of the world, India also probably we would have done well to immune people against it. But to come back to the larger question, how is it going to change the public health discourse in India, and is our infrastructure sufficient? Clearly not. Today there's a report in the Economic Times where the government of India actually asked district magistrates. In India, districts are the basic administrative unit, not the basic, but at the level of the Indian Administrative Services, district magistrates were asked to tell about their preparedness. So a district magistrate in Arunachal Pradesh, which is India's biggest state in the northeastern region, he's actually said that the nearest COVID-19 testing center from my district is 400 kilometers away. And I am telling you, the kind of migration regime we have in our country, a lot of people from even Arunachal Pradesh come and work in these places. So you actually have very free flow of, in this case, unfortunately, the pathogen carrying persons, but you actually have not had a free flow of medical services. I would like to hope that once this has happened, the government would put in place some sort of a screening mechanism or basic testing facilities. There would be some ramp up of facilities, etc. Before all this happened, in the previous, in the budget which was presented on the 1st of February, Government of India had actually put proposed a plan to privatize district level hospitals. Each district in India has a central hospital which is supposed to be a specialty hospital. Given the fact that a lot of reliance, not only in India but in the entire world, is actually it is the public sector health units which are leading from the front line in this effort against COVID-19. I would like to hope that there's some sort of strengthening of the public sector health infrastructure in India also. Let's hope so. We'll have to see what exactly happens.
Yeah, so long as we are on the subject, here is some data which might be of relevance of interest and relevance to our audience. To India's total health expenditures constitute only 3.7% of GDP, of which government expenditure on health is 1%. Little 1%, could be 1.1, could be 0. Less 1%. The average for low-income countries and middle-income countries, India is a lower middle-income country now. India is no longer a low-income country after the growth of last 20 years. So the average for low and middle-income countries is 5.4%, not 3.7% as in India, for the larger society, and 2.7% for the government expenditures, not 1% as it is for India, right? So, as we think about what this means, not only for the response to COVID-19, but the ongoing efforts against malaria and tuberculosis, just keep in mind, I think one should keep in mind that India's government health expenditures are almost abysmally low.
Just to add to that, Varshney, I think I'm more optimistic here than in, say, diseases like the tuberculosis, etc. Because this disease, because it is so highly infectious, even the elite would have a vested interest in ensuring that the state puts in place a robust screening mechanism and treatment mechanism. Whereas a lot of, large part of the story of decline of public health and public education in India has also been an elite flight, which a lot of people have written about.
I see. So you're saying not many rich people would have TB or malaria, and that's primarily a poor person's disease.
This is something they can protect themselves against.
Right. So
everybody is going to be extremely scared of COVID-19. So they might demand that the state should take the lead in this.
And that's an interesting political point.
Setting up a malaria hospital in a far-flung district in India.
What I wonder is, would the elite of India just go through privatized hospitals, right? Exactly. Where they're willing to pay for the actual test, where it's not really demanded by the government. They can just go and get the test because they have the money to do so, while the people who need it the most, specifically after this, the lockdown in Delhi and people are going back to their rural communities, they don't actually have access at all to testing. So I think that population will definitely demand the testing to be done, but they have the resources to kind of get the test that they need, and thus the government doesn't have to come up, is not demanded or pushed to the breaking point to then really have to implement.
But in this case, it is not enough to get you tested. The other guy also has to be tested. You can't go test every day, right?
Yeah, that's true.
They would want this to be an egalitarian access service. Is my point.
That's a good point.
There's a question that has come from Stephen Bloomfield, which it can be presented in two forms. One, what he asks here, but before I read out what he asks, let me say something which, while preparing for this seminar, I noted. Four of the most successful attacks on the coronavirus spread have come from Singapore, Hong Kong, Taiwan, and South Korea. It so happens that these were also the first Asian economic tigers and the first successful development states in the third world: Hong Kong, Singapore, South Korea, and Taiwan. They managed to build great state capacities and great public health systems. India's state capacity, as we've been discussing on public health systems, are quite rickety. But this kind of question, why some states some nations in the world did a much better job than others, why these four, can be turned into a question about interstate variation in India, which is what Stephen is asking. So Steve is asking, did some Indian states distinguish themselves in confronting the virus by means of enforcements of the highest public health standards before the national government stepped in, and which were they, and why those and not others? We know, or tell me if you share this understanding, Roshan. We know that the southern states, especially Kerala, and I think Tamil Nadu also, we know that the public health systems are much better. Much better. I've seen data on that, and Kerala is of course well known, but even Tamil Nadu now should be included in that. I've seen data on that. They are much better than northern Indian states in general, and even western Indian states. They're much better. So, in your view, has Kerala distinguished itself in confronting the virus? And has Tamil Nadu, if not distinguished itself as much as Kerala, done quite well? And are there any other states that come to mind which might have done well, and why might that be so?
Well, Kerala definitely stands out as a case, because the first cases actually came in Kerala, and this is not the COVID-19 is of course much bigger in scale, but Kerala a couple of years ago dealt with the Nipah virus, which did not become an epidemic but had the potential of becoming an epidemic, etc. So they are definitely, and I think Kerala has a history, so it has the institutional wherewithal to do so. But I think praise must also be given to the current state government leadership, especially the health minister, she's actually won a lot of praise, the manner in which she has handled it. But like I said, it is not just the Left Democratic Front government there, but it's the institutional history which is helping the state cope with all this. Tamil Nadu, yes, it is much better than what a state. Because we have to remember, Ashu, that in states such as Bihar, the state I come from, public health infrastructure is actually non-existent. It's not a question of it being good or bad. It does not exist. So in Bihar, no matter whether you are rich or poor, if you have fever for 10 days and you don't get better, you come to Delhi. So if you go in front of something like AIIMS in Delhi, which is the biggest all India hospital in the country, people actually live on the road and get treated there. So we are talking about non-existent public health infrastructure. I mean, medical colleges, district level hospitals, they are completely defunct. They don't have anything. The biggest crisis of personal protective equipment is coming from states such as Bihar, because doctors have absolutely nothing. That's there. Now, coming back to your larger question, I think Singapore, Taiwan, and Hong Kong, they are actually very small countries. So, and I don't think they compare with a country like India, of course. And Singapore, unfortunately, has had to go in a lockdown again now. They will be going in a lockdown. That's there. But, like I said, also, these are also countries which have had very authoritarian regimes, which is not something which, we have had in India. Never. So even this, I don't know how easy it will be to extend the lockdown if the government of India has to extend it. Not only because there's considerable economic hardship, but beyond the point, and I don't think the population takes very kindly to the idea of the state imposing so many restrictions. They have never been used to. Even in the emergency, there were no restrictions on mobility, etc. There were restrictions on political mobilization, and those are probably increasing in India as we speak today. But the Indian state has not a history of such restrictions on individual mobility. So these are very testing times for India. We have to at least in the short term, we have to make do with what we have. So this is going to be a very testing time. That is why I think the top leadership has to play a very important role.
Yeah, Patrick Heller, our colleague in sociology, who was also a specialist of Kerala's political economy, in a meeting this morning said that I may be slightly off on the precise statistics, but not terribly wrong, not violently wrong, somewhat off I could be, but more than 100,000 people in Kerala have been individually isolated and medically surveilled by the state. This is not a capacity that any other Indian state has. Kerala has built that capacity. It can surveil medically 100,000 people. Tamil Nadu can do perhaps a certain proportion of that, but no, it's not clear that a North Indian state can medically surveil the progress of a patient, a progress of even 1,000 or 2,000 or 3,000 patients.
Exactly. See, we have to remember that Kerala, I mean, of course, I mean, it's a democratically elected government out there, but that government also has a Stalinist organization at its beck and call. And, I mean, such has been the political tradition in Kerala that a lot of party people are actually accommodated at various levels of the government when they come. So, reports have been coming in that the government has actually been using its, the party has been using its mass organizations such as the Youth Front, etc. So, there's a very organized effort which is underway in Kerala right now, which, I mean, the BJP is politically very successful, but even today, I don't think they have the kind of cadre which the CPM would enjoy in Kerala, the cadre base. So that also makes a lot of difference.
So there is a pre-existing organization that is that can do medical surveillance,
which is not something just in this crisis. Even when the floods came in Kerala, the kind of outreach the diaspora made, both inside and outside the state, and the diaspora outside the state and inside Kerala also the kind of outreach. I mean, that's a very different.
Let's open up for Q&A now. Who would like to ask? I do have some other questions, but let's hear from the audience. Are there questions from the audience, or shall I continue? Okay. So, one question that a lot of people are asking, it's not a strictly, it's partly economic, partly political. So it's a political economy question, let's say. Was the lockdown, a national lockdown, really necessary? What do you think?
It's a very difficult question to answer because right now we are faced with a choice between saving lives and saving jobs. The lockdown clearly shows that at least the intent as of now is to save lives. People should not die. And it's not very difficult to understand. I think today, with so much democracy and development, I mean, tolerance levels to people dying in peacetime have come very low. And I don't think this is something we should be, worried about. I mean, this is a good thing. Everybody should have a right to live. But if there's no solution, in the next month or so, I think this question is going to be becoming more and more pertinent. So, I mean, I can see that today it's all right to castigate political leaders, etc., who are trying to open up the economy. Which way the balance will tilt, even a month from now, is a very difficult question. Sanjay Reddy, you shared it with me. He's actually written a very longish piece in Foreign Affairs and a small op-ed in India, dealing with the larger philosophical questions which are involved. But I think, at one point of time, we'll have to take a call. The idea was to flatten the curve. If you open the economy today, and if you are asked to go in a lockdown a fortnight from now, I do not think that will be as easy as it sounds. It's very difficult.
But nonetheless, the question remains, you could have, let's say for health reasons, for saving lives, you needed to, or you had to announce a lockdown and impose it, right? But couldn't there have been a better anticipation of how many thousand or if not exactly how many thousand, but how that lots and lots and lots and lots of people who came from the countryside, who lost their jobs all of a sudden, who didn't have homes where they could live, and so many of them live on the sidewalks, sleep on the sidewalks. Don't you think it could have been better anticipated and something could have been announced for them?
In India specifically?
Yeah.
I would like to look at it in two ways. One, why was it not anticipated? I think there, and the kind of capitalism we live under today,
yeah,
the basic conflict is always between sacrificing today's profits or whatever we may choose to call them. I mean, for preserving tomorrow's gains. So I think the trade-off is the same. Something as basic as climate change, which there's irrefutable evidence now that it is going to be leading to a lot of problems in the not so distant future, maybe 5-10 years from now on. We are actually seeing effects. The US government refuses to acknowledge it because why? It's not that it is because there's a tangible cost to fighting climate change today. I think somewhere all governments, including the Chinese government, which now people are saying that initially did not reveal the true picture to the World Health Organization, which indeed misled. Let us take it at complete face value. China did not tell it to the WHO. WHO said there's nothing to worry. Everybody else took WHO on face value. I think the reason the Chinese did not do it must have been, they are authoritarian, of course, but it must have been the larger economic cost of it. That must have been the reason in India also, because had India gone in a lockdown, say a month from now on, and even these cases could have come, because there's nothing which stops cases from coming in. Even a freak incident the disease is so infectious. So it was never an easy choice to make. As far as the question of would something have been done for the poor people is concerned, I think in India, and I say this with a lot of conviction, ruling regimes are not scared of a backlash from poor people. Remember that this is the same government which did demonetization, and they would have known what hardship it would bring to the poor people, but they know that politically things can be turned around. So it will not come back to hurt them politically, which is why I say that this is a once in a lifetime opportunity of actually mobilizing the poor people.
I see.
You have the Prime Minister is saying light a lamp, do whatnots. These are basically, political tricks to keep the population engaged. He knows that this will work, or at least he has the confidence that it will.
Right. There's one more thing, maybe one final thing before we end this virtual seminar. And you might have a view on that, and certainly the public health specialists in our audience might have a view on that. It's been widely speculated. And last night, I heard Dr. Fauci say, actually on CNN, that coronavirus, like many other, if not, maybe he said all other, maybe he said only, certainly he said many other respiratory viruses would thrive in what he called cold, dry weather.
Yeah.
And not thrive in what he called hot, humid settings. So he said it's a cold, dry versus hot, humid issue. And a lot of people have reported that the Indian numbers, both the number of infections and the number of fatalities, appear to be tragic and awful as they are, appear to be low. When compared to what's happening all around in Asia and all around in, certainly if not in Asia, certainly northern part of Asia is quite cold. So northern China is quite cold, and north of Shanghai is pretty cold, and Europe, which is cold. So, and United States, the northern part has suffered most, it seems. California has, but it seems to have brought things under control. So do you think that Indian numbers, which are low, are at least in part a consequence of this epidemiological issue? And India is simply in the early stage of a curve which can become exponential later? Because all countries, even those going through a lot of suffering now, started just a month or two back with just one one fatality or two, and now it's exploded beyond
When I
imagination.
came to the US a month ago, it was actually better off than India is today. So,
Right.
well, I would like to hope that what Dr. Fauci said is correct, but I'm afraid we do not have enough evidence to say that it is a fact in India, because of course, testing is very low. I mean, and India is a country of 1.3 billion people. But forget testing for a moment. In India, the two major hotspots right now are Maharashtra and Kerala. Kerala actually is, the heat's pretty extreme there right now. They must be doing, I think, large parts of Kerala are actually doing 38, 39 degrees centigrade today. And because it's the coast, I would like to think that it's humid also. Not as humid as it is during the monsoons, but of course it's humid out there. That has not prevented infections from rising at a very fast pace. Whereas northern states are actually better off, where it is still summer should have set in by now, but it hasn't this time because of rains in March, etc. It's been delayed. So we don't know that yet. Let us hope that it is true, but I think it would be. We will have to give it more time.
Right. Do our public health specialists here in the audience, David?
Yeah.
Would you have a thought on this? Humid, hot versus cold, dry?
So
would you have a thought on this?
This is William. From an epidemiological perspective, it does actually have an impact. So if you look back in, like, the biggest example that they keep on using or talking about is the Spanish flu. So the Spanish flu was really, really big during the springtime, and then a lot of casualties. And then in the summer, the rates actually drop significantly. And then in the fall, it goes back up again. So usually there is a climate kind of weather pattern that actually does happen with respiratory infectious diseases. And I could see that also happening in India as well. And I think it's hard to tell first, like you said, because of the testing, the lack of testing. So we actually really don't know where we actually just don't know. And then the second is that I think it's kind of too early to kind of project how bad it's actually going to get.
Right. But there's one, so in another argument that emerged about India, why the numbers are low, well, of course, one hopes they stay low. Whatever has happened is still is bad enough. Is that crowding or overcrowding actually goes against India, even if hot weather goes in favor. There is a lot, the density is very high. If anyone who's been to Bombay slums knows how dense Bombay is. And an estimated 52% of Bombay city lives in slums. More than half of the city lives in slums. So you can, even if hot and humid, and Kerala is also very dense, incidentally, as we know. Kerala villages are also dense. Kerala villages is simply another extension of the city.
They're as good as cities. There's no difference.
They're just another version of the city. So, but one more thing about Kerala is that Kerala perhaps has the largest proportion of migrants, including the number of people who are in the Middle East and keep coming back. When I was working in Kochi, the number of now people from the northeast and Bengal who are in Kochi, and that's also very large. It's quite possible that as a state it attracts a very large number. May not be as large as Karnataka, but Karnataka is only one city, Bangalore, which attracts so many. There are just a lot of cities in Kerala which attract migrants. So
India has 5 international airports.
And it has 5 international airports, right? No other state in India has 5 international airports. So the denominator could be very high. The catchment, right? The denominator could be very high.
And Kerala testing rates are also the highest in the country. So
Kerala has the highest testing rate. So, so you may be right that we can't be sure whether this is the early part of a rising curve, or whether what Dr. Fauci said yesterday on CNN is a very big factor. Namely, the virus does not have as much potency in hot and humid conditions as in cold and dry conditions. And yes, we'll know as the weather gets hotter in India, and now it's, we already, by the time it's late April, it'll be very hot, and May, it'll be very hot. So we'll see. Any other question that people would like to ask? All right, it's time to thank.
Can I ask you a question, Dr. Varshney?
Yeah.
You know, once this is over, and let us hope that it is soon enough, we will of course see demands from poor people vis-a-vis the state, rich people vis-a-vis the state. But there will also be demand which the state will now make on the people. One of the biggest concerns which has been raised is it will demand a lot more access to private information. So the state would turn into a vigilante state, would try to keep track of everything you do, where you go, where have you been, who do you meet, etc. How do you see this panning out in the future?
Oh, in my view,
so Europe was the biggest champion of privacy, etc., and they have been the worst hit. Yes. I'm not saying the two are related, but
I certainly think it. Well, you can think about it in two ways. One, a tendency towards centralization and greater authoritarianism and greater state interference in private life. That's right. That I think what you just laid out is one scenario, which is one tendency that will certainly emerge. And the government in Delhi today is not particularly interested in not interfering in private lives. That is not its view. The whole notion of discipline, social discipline or national discipline imposed on individual citizenry, and it's not very fervent advocacy of individual freedoms. That, to put it mildly, actually, to put it euphemistically, it's it doesn't like the notion of individual freedoms as much as some other political formations in India. So that this kind of crisis works into that narrative and is likely to entrench this tendency. On the other hand, what you laid out in your article and what you also said today, there could be a lot of citizen demands as misery and suffering become much larger than they were under demonetization and last much longer, right? So there could be the possibility of greater citizen pressure on the state. Very soon it might be tested if a second lockdown is ordered, let's say end of May. After this it is released and another lockdown is necessary, let's say, and it's ordered. Let's see what the state does at that time and what citizens do at the time. But how these two will net out, I don't think we can be very sure at this time, but I would suspect my hypothesis would be that the state interference in private lives, in the realm of private information, and therefore greater state authoritarianism is a more likely outcome than a mobilization of citizenry and citizen demands on the state. That is my hypothesis, and I would be happy to be wrong. But I think this works. Crises of this kind normally, not always, normally make the democratic governments also quite authoritarian. That has generally happened. So this is a real pandemic. This is entirely unexpected, and the state has considerable power to just go inside homes and track you down, and some of that can be very widely abused. Some of that would be very genuine, some of that would be very widely abused. The cops and the bureaucrats don't necessarily act according to the mandate, right? The mandate is often abused. They use their power on the ground to abuse the mandate, and therefore excesses, bureaucratic and police excesses also should be expected. So this is hopefully the suffering would not be as long as some people have predicted. We don't know. Hopefully the hot weather and humid weather would work the way Dr. Fauci says it will. Hopefully, we don't know that either. But if this becomes exponential in India, then we are in for some very hard and troubling times. Because the public health capacity as we've discussed, the public health systems, the healthcare systems are quite fragile. And this is not something that private doctors and private practitioners of medicine can easily handle. So that brings us to the close. And thank you all for joining us. And thank you very much, Roshan, for giving us your time, your thoughts, your analysis.
Thank you.
And hope we'll have another chance to engage you, if not during this stay of yours, but perhaps in the future.
Yeah, in better times. Let's hope so.
Thank you. Thank you.